Welcome to Deuk Spine Institute live spine surgery. It is May 21, 2026, a Thursday. Our first patient comes here to Deuk Spine all the way from Washington. Now, he has already had surgery here at Deuk Spine Institute over a year ago. He had Deuk laser disc repair, C3-4, C4-5. He did fantastic. And now he wants more work done. So we're going to be fixing 2 more discs today, later. But right now he's got facet joint pain, which we have not yet treated. Facet joints are the second most common cause of neck pain after the discs. Disc injuries are number 1 in terms of causing neck pain. He has neck pain. It's bad. We know it's coming from his facet joints and the discs. We're going to start this patient off by treating his facet joints, bilateral C3-T1. So go ahead and show the audience how facet joints become injured, how they become degenerated, and cause neck pain.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals.
Video that the facet joints become injured through trauma, just like every other joint that gets injured in our body. Once you have trauma to the facet joint, you have an injury to the capsule. Once the capsule is injured, well, there's no coming back from that. You're going to end up getting arthritis over time. The arthritis takes up to 20 years to really become symptomatic. This patient, his injury was a long time ago. He's had neck pain now for 15 years. And as I said, he's came back here and had his discs treated. Now he's getting his facets treated. All right, let's show the audience how we actually treat facet joint pain.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4 mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debreeds the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 34969.
Welcome back. You can see from the video that we actually go in with what's called a plasma wand and destroy pain nerves to the joints. Those pain nerves are called the medial branch of the dorsal ramus. The medial branch of the dorsal ramus is a nerve that comes out of the neuroforamen, which is the hole where nerves come out of. And it travels from the neuroforamen over to the facet joint. Now, each nerve that comes out of each foramen splits into 2 nerves, a top and a bottom. And the top nerve goes to the top facet, superior facet. The bottom nerve goes to the inferior facet. But basically, each nerve innervates 2 joints, the one above and the one below. Any questions from our audience?
No questions.
All right. So at this point, we're just about finished with left side facets. We're going to move on to the right side in about 5 minutes or less. Any questions?
No questions.
Is that Nikki? Huh?
I think he was given a suture removal kit, and Luis discussed it with his wife, who's an RN. I think the suture was yes, it was not the suture. That's okay.
Is that Nikki?
No, this is Remy.
Oh,
All right.
tell Remy I said hi. I think we're done on the right side. Did I say right before or left? I meant to say right. I apologize. We're on his right side at this point, not yet the left.
His pain with that. But not pain. But the shoulder's fine.
He's happy with his shoulder.
He's having some pain in his shoulder. But we're doing a 2-week follow-up. And he was here at 8 and left right away.
Okay.
Okay, that's wonderful. All right, Remy, thank you.
Thanks, Dr. Bernard. So Remy is answering for Damola?
No, Kamola didn't answer the phone, so
Oh,
I'm very tenacious, so I called
I think that's great. All right, we finished the right side and we're going to be going to the left next. Blood pressure still good?
Yep. We'll get it down a little bit.
Go ahead.
It was pretty good.
You know, for these, Luis, I think we don't need IABand.
Oh, you want?
No.
Yeah, I do it because the hair, it's too close to the hair. But it's okay. We can do it.
Then maybe
No problem.
just
a
just
straight
the
on
hair.
top. Yeah, yeah, no problem. Do you want to say that?
Sure. All right, any questions from the audience? We've just finished one side shot. We're going to go to the other side next.
Yes, we have a question from
Go
Jessica
ahead.
on YouTube.
Hi, Jessica. Welcome to our live stream.
After this procedure, does the facet still have inflammation?
That's a great question. The answer is yes. After the procedure, the facets will still have inflammation because we're not curing arthritis. We're just curing the pain from the arthritis. Unfortunately, as of this year, there is no cure for arthritis pain. In 2026, there's only basically remove an arthritic joint completely using joint replacement, which we don't want to do because that's highly invasive, and you can't do that for facets anyway. They've been working on doing a fake artificial facet made out of metal, but they have not yet perfected it. And as of now, we don't have a good facet joint replacement in the neck especially. So all we have is radio frequency ablation, which is just temporary and does not give a permanent result.
I want to feel like a metal facet joint's not going to work.
Well, people were talking about metal facet joints when I was a resident. And
Did Frankenstein have a metal?
Frankenstein. Yeah. And they just were, the problem was they get loose in the bone because you have to anchor them into the actual vertebrae, and they get loose. They start to have failure at the bone implant interface. So they don't last. I don't think they ever got FDA approval, but maybe they did. But certainly hasn't been popular. Not recommended by a lot of doctors. So there is no way to cure the arthritis. There is no treatment on earth that cures arthritis in joints, but there are treatments that treat it. Obviously, treatments like anti-inflammatory medication and shots can actually treat arthritis and reduce it temporarily, but they're never going to cure arthritis. So the best you can do for somebody with arthritis in their joints is to eliminate the pain that's associated with the arthritis and restore normal movement. By taking away pain and letting them have movement, you're basically giving them back normal function, right? That's what it's really about, restoring movement that is pain-free. Pain-free movement. That's the best we can do. Now, when it comes to knees and hips, we've been doing that by taking them out, removing them from the body, and replacing them with metal and plastic knees and hips. But we don't really have that option with facets, and that would be very invasive and dangerous for the patient. So we found a way to do this that's minimally invasive, and it involves just destroying the pain nerve, which has been a long time goal of doctors for many years, but we haven't been able to do it until now. I actually discovered this technique of destroying the pain nerves permanently, but every other doctor out there offers a temporary treatment called a radiofrequency ablation. The problem is two things. One, with radiofrequency ablations, you have to come back every 3 to 6 months and get it done again. And the second problem is they stop working after 2 or 3 times, because the scar tissue that builds up in those joints becomes so massive that the scar tissue blocks the radiofrequency procedure from actually working. I got about a minute left, and then we're done with his facets. Any other questions?
Yes, we have a question from Bappy on Facebook.
Dappy or Daffy?
Bappy, B-A-P-P-Y.
Yeah, I think we had Bappy ask a question last week, right?
Yes.
All right, Bappy. Thanks for joining us again.
What procedure do you suggest for disc degeneration at C5, C6, C7, and as well as facet joints?
Well, Bappy, I recommend this procedure you're watching right now for the facet joints. It's the best treatment available in the world today. As far as the disc degeneration, that's exactly what this patient has. We're going to be treating his discs next. That is our next treatment. So if you come back in 10 minutes, 15 minutes, you'll see we're going to be doing the Deuk laser disc repair for his discs. We're done. You guys want to see the incision? Let me show you the incision. It's 4 millimeters. This surgery is done with a 4 millimeter incision.
Okay, yeah.
Let me show it to you guys. Is that the molar? You guys see this? The whole surgery is done with 2 little cuts, one on the left, one on the right, and virtually no bleeding, no downtime, no restrictions, no hospital, no pain meds. He will take maybe anti-inflammatory tonight for this procedure, but that's it. No more pain meds, no narcotics. And we'll be back shortly in about 15 minutes or so for our cervical Deuk laser disc repair, our version of laser spine surgery to treat 2 herniated discs in his neck. Thanks for joining us. You can go ahead and run one of our testimonials. And good morning, I'm Dr. Deukmedjian at the Deuk Spine Institute. I'm here with my patient who traveled to Deuk Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4 millimeters. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off the bike.
And you've been suffering since then.
Yeah.
Why did you decide to come to Deuk Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
Infusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen, the risks. It was just too much, and actually kind of scary because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff back in your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck, and it was really bad. I would turn my head anyway, and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research, trying to look for exercises I could do to help my disc, he popped up on my feed and said, "Do you have a herniated disc? I can fix you." And the more research I did, I was just so thrilled because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it and I was like, "You're done already?" The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Deuk laser disc repair and the Deuk plasma rhizotomy. You can see in your video here, we went into your disc, we used the laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here.